So I have started recording. So the first person we're going to have is John Cluis, and he is, I don't know his title exactly. I'm sorry. I will let him tell you his title. He is from Career Steps. And we're going to have John come on and give an introduction to his program. And John, just let me know when you're ready for me to display your presentation.
Yeah, let's do it. I'm ready.
All right. There we go.
Well, good morning, everybody. Really happy to be here. I always like to start off with this slide because Career Step is sometimes complex with what we do in the allied healthcare training. Our role and mission is to increase retention, reduce costs, and develop your teams. Caris is our parent company, and I work under the Career Step umbrella, which is the allied healthcare training, and we also work to help place our learners within healthcare organizations across the U.S. Go ahead. Next.
Sorry, I'm going to see. To like go.
Just try your page up or page down button.
Okay.
Oh, there we go.
Okay.
We're good. So as Jillian says, she didn't know my title, but I am our national manager of our healthcare employer partnerships. And I always like to put the logo of our partners who we're working with on that left side, but that's who I am. I've been with the company for just about a year. Next week will be 1 year. I have about 10 years of experience in healthcare, 10 years of experience in executive staffing and recruiting, and 10 years in the education space, both adult education and STEM. So this organization kind of combines all of my experience into one company. So this is really exciting for me to be a part of this. Next.
Okay, I'm hitting page down on it. It's not going, so.
Oh, no.
I know. Oh, there
like I said earlier, technology. we'll motor through this, but we really would like to, and what our goal is to be your trusted partner for both talent retention strategies as well as talent acquisition. You can go through next, and we'll kind of go through our overview. So our mission is to make allied healthcare training professionals like accessible, efficient, and effective, and affordable. Our solutions across the board are 100% online, and we don't call them students, we call them learners. They are, because we are solely focused on professional training, and we focus solely on those folks who want to get kind of that first job in allied healthcare. For instance, medical assistant, dental assistant, pharmacy tech, what have you, or we work with partners that want to upskill or reskill their staff to become certified in those various areas and advance in their career. So we work with a lot of organizations for those career ladders and career advancement strategies as part of the talent retention. Next. We have been around a long time. We've been around for 30 plus years at this point. We partner with all of the third-party certification associations. They monitor and audit our content and our programs to ensure that we're meeting all of the industry standards. And as part of that, those standards, when a learner finishes with any of our training programs, we actually provide the vouchers to go sit for those certification exams as part of the overall program. We work with, right at now, the employers, it's close to 1,500. And we're way over 300,000 learners that we've trained. It's asynchronous 24/7 learning. We provide 24/7, 365 support to every learner, whether that person is coming to us directly or through a partner network. We provide the same level of support. So when somebody enrolls in one of our programs, they get advocates, they get access to instructors, they get phone, email support 24/7. And we also have a really cool community where they can log in for other people that are in the medical assistant program to kind of do some networking and understand what they're going through to finish their program. And like I said, we've got 70 plus different programs in and around the allied healthcare space, which comprises 250 plus courses. So we're pretty comprehensive in this area. Next. Yeah, so this is just a quick slide. We really want to be kind of everybody says we're kind of a SaaS model. So this is where technology, people, and healthcare converge. We are multi-tiered, so the platform is geared towards that asynchronous learning, to where you can log in at any given time of the day, night, weekend, whenever you want to continue your training and prepare for that certification. In addition, what's really cool about this technology is that when we partner with an organization, we also provide that access to the leaders within that organization so they can come in and monitor and see where their staff is at any given time through any of our programs that they're training on. So this is kind of where we say, the technology, people, and healthcare converge. Next. We'll send this out, but yeah, we really kind of want to improve, connect, save, and help you upskill and retain your staff, as well as we can use our ecosystem of current and past learners to discover talent to fill some of those gaps in your organization if you're hiring. I know for these purposes, Jillian and Jeff, we're solely focused on the training aspect, but I do want to just mention that we do have a whole nother arm that reports to me as kind of that talent acquisition strategy as well.
All right.
Next. Okay, go ahead. So when you look at our programs, we have 4 different tiers that we focus on. So we want to, at the very lowest level, provide those skill sets that are going to be necessary for that person to get a relevant job in this career. So it's basically the basic building blocks to define those skills for them to get a job. Then we kind of go upscale from there. So we kind of look at the day-to-day task and the responsibilities, and we start honing in as the program continues to define those skills at a deeper, more meaningful level. And then we go a step further to provide opportunities and training programs and skills that's going to advance them in their career. And then finally, we have these specialized skills. So somebody can come into our program and then decide that they want to be, become a medical assistant, but they also want to become an EKG tech or a phlebotomist as part of that program. We give them the ability to specialize in certain allied healthcare careers. And so I think that's really one of the areas that sets us apart too, is we provide those areas where they can really specialize their career path. Next. It's just a quick slide. We have way more than this. As you'll see, these are kind of our top 10 programs. The contact tracer is one of those things where it was really important as COVID was out there and we were really trying to focus on contact tracing. I think we kept it in here because if you listen to the news or see the news, we're seeing that there's another rise in the COVID infection rates again. So we kept this in. Contact tracing is something that was super important last year and the year before. We're starting to see a trend of some of our partners and actually learners coming off the street wanting to get some skills in contact tracing as well. Next. These are our accreditation and third-party certification bodies that we are very tight with and partner with. They literally, like I said, we have a great relationship with all of these organizations. When there's new content, new regulations, new data, they push that down to us and we enter that into our curriculum immediately because we always want to maintain that status. And we want to make sure that folks that are coming through our program have the latest skills and latest knowledge for them to sit for those certifications. So these are some of our third-party accreditation partners. This is just, kind of an overall from our learning framework. We want to provide obviously high quality, very convenient. Like I said, it's 24/7 access, so you can literally log in and do your coursework at any given time. And then our service, our tech support, we treat every partner, every learner, what I call kind of white glove. When somebody enrolls in our program, they are assigned a learner advocate. That person is with that learner through every step of the program. They're there to help support. Sometimes they play therapist. Sometimes they just play lend an ear to me so I can just talk about my stresses and what's going on in the program. And other times they really help focus on getting them in touch with the instructors and labs and all that kind of stuff. So we provide all-around support for every single person that enrolls into our programs. Yeah, it's kind of, again, it's self-paced, virtual instructor-led training, scenario-based, and we also have virtual reality. The VR kits are coming. We call it extended reality now, but we are working with a provider to actually do the VR goggles. So as you see in some of these commercials, these folks are kind of doing their labs and doing this cool stuff in healthcare with virtual reality goggles. So we're getting there pretty quickly. I'd say by next year, we'll probably have that technology in place. Okay, go ahead. And this is kind of what I said about our support. This is kind of advances that, just to kind of get a little data points on every person gets these folks as part of their overall program to support. Go ahead. Okay, so the meat, what everybody wants to talk about, our medical assistant program. So we got through the flow, so let's talk about our program, medical assistant. So if you look at this, so we kind of break down our program into kind of the overall courses, and then we have modules, and then we have units. So every one of these are all of these listed on this sheet are the courses, right? And then there's tons of content underneath each one of these courses that breaks it out. And I can share that all with you just so you can see a breakdown. We have a learning objective and overview sheet that goes through the detail of everything. This is just at a high level for time purposes. It would take probably an hour to go through all of them if I went one by one. So I'll send this out, Jillian and Judd, to you, and you can share that with the team as well. But the total program is 583 hours. 100 of that are what we call the externships. So at a certain point, they satisfy their clinical externship rounds. I know with the folks that'll be going through the program with this team, they're already working. And so they'll be able to satisfy those externship hours if they need to on site through this program. So it's really kind of 483 total hours. Next. Here it is right here. So don't pay attention to the pricing. That was baked into the presentation. And for some reason, because I'm technology deficient these days, I don't know how to get it unbaked from this presentation slide. But this is when anybody gets enrolled in our program, they get 12 months, so 1 year of access from the date they get enrolled. So let's say you have one of your staff members gets done in 6 months. They will still have an additional 6 months to go back in and review the material, the content, the data, labs, tests, whatever they need to do for refresher if they want to. So we provide that 12 months. I know a lot of our partners don't want to give 12 months. They're like, these people need to be done in 6 months or less. But regardless of what the company decides, we still give that person 12 months access. And then at the end, which is what I was talking about earlier, as part of this program in particular, we actually provide the vouchers for the CCMA, the CMAA, the CPT, and CET. So I will tell you that pretty much regardless if the person comes through a partner or they come from us just off the street wanting to become an allied healthcare professional, most people want to take all 4 exams. So they tell us, like, listen, I don't just want to become a certified clinical medical assistant. I want to be all 4. So they take all 4, and that's totally fine. As part of the overall cost, we provide those vouchers. If the person comes back to us and says, I just want to become a medical assistant, that's fine. They don't have to do all 4, but they do have that choice. Next. And here's just kind of review of that slide again. It's a little bit redundant, but these are the 4 certification vouchers that we provide as part of the program. And that is it. See, I didn't even take 15 minutes, did I? That was pretty quick.
You did pretty good.
Yeah. Usually I get rattling on and on and on. And so people are like, okay, you're past your time. So I'm trying to keep it shorter these days.
All right. Thank you so much, John. We appreciate it. Does anybody have any questions for John at this time for Career Step?
And like I said, I can share all this information out. You get the presentation as well as I'll send over the learning objectives and data sheets, and so you'll have the full information on the program.
All right,
Hi, John.
Okay. Go ahead. Go ahead.
Hi. Oh, there are 2 of us. I'll be quiet.
Susan, I think you're on mute. Can't hear you.
Not sure what happened. There's a question that says,
I would encourage people
go
to,
ahead.
okay, I'm sorry. I would encourage people to put your questions in chat, and then maybe, Jillian, we can handle them at the end, because they could apply to all three programs. So make sure Pat and Lori get enough time.
Okay.
Yeah, that's totally fine. However you all want to work it, I can answer in the chat, or we can just kind of get a list and then we can answer later. However you all want, it doesn't matter to me.
You can answer in the chat, John. That's fine.
Okay. Well, if I can find the chat, let me see if I can find it.
All right. So next we're going to have Pat Bricker from AHEC. Pat, I'm going to share my screen so that your slideshow will come up. Okay.
Sounds great. Thank you. All right. So thank you all for having us here today. And we're happy to share some information about our state accredited community health worker training program. Just a really quick overview of Pennsylvania AHEC. We are Pennsylvania based. Obviously, we're a statewide organization. We have a program office at the Penn State College of Medicine in Hershey. And then there are 7 regional offices across the state that provide our programming on a regional basis. And you'll get to meet Liz Schaefer, who will be tag teaming this presentation together. Liz is one of our lead community health worker instructors in the state. She actually developed the program over 10 years ago and has been teaching it ever since then, and has led a couple of updates to it and helped us, actually led the process to get us accredited by the state for any community health workers that go through our program will be eligible once they get their work requirements to become state certified by the Pennsylvania Certification Board. And then also joining us is Amanda Taylor-Gaiman, who works for Pennsylvania AHEC in our program office and has been working a lot with us on community health worker training, community health worker continuing education, and also health equity programming that we are launching. So if you go to our website at paahec.org, you can learn more about that. In short, Pennsylvania AHEC is an organization that exists. AHECs are national. They're all across the country, and we exist to recruit, train, and retain healthcare workers in rural and underserved areas of Pennsylvania for us and elsewhere in the country. So why don't you go ahead and we'll get into the meat of the presentation. I think Liz is going to do the first couple slides here, and then we'll tag team from here.
Thank you, Pat. Good morning, everyone. I'm excited to be here and to talk about our community health worker training program. So what is a community health worker? Well, they are passionate, dedicated individuals that act as community connectors. They bridge the gap between the community and services, everything from transportation to social services to the healthcare system and that patient, client, or consumer. They also help individuals navigate that healthcare system and insurance, as well as help with those basic health literacy needs and understand kind of their health issues and what they need to do for that. They're also advocates for the individuals that they serve and the community. And community health workers have this awesome kind of domino effect that happens when they work with individuals because their passion and willingness to help others kind of helps others wanting to help others. So it's really kind of a neat thing that happens when working with community health workers. They're amazing. They actually improve quality of life and health outcomes. And about just a very quick story to tell you about the power of community health workers. As Pat said, I've been part of community health workers and community health worker training for over 10 years. And we've done many trainings, and there are some stories that I remember year to year and stand out. And this story comes from a Reading training in Berks County that we did. And we actually trained a security guard at, it was called Reading Hospital, now it's called Tower Health. But anyway, this individual was security in Tower Health, and went through the whole community health worker training. And part of her training, she did our mental health first aid training, which is a national program. And she learned all about the mental health resources available in her community. And as a security guard for the hospital, there was one individual that used to keep coming into the hospital on a regular basis because of suicidal ideations and some issues. And he just kept coming back over and over and over again. And after she had gone through the training, and after she had learned about mental health first aid and the resources, she had actually approached him one day and said, "Has anybody ever talked to you about the local resources that are available?" And he said, "No, you know, I have these issues. I'm admitted to the hospital, and then I'm released, and unfortunately, you know, I'm back here again." And so she provided him with the information about the local resources and actually Berks Counseling, and said, "I don't know if they'll be able to help, but it's worth a try. Here are some resources." And so several weeks go by and she doesn't see the individual again. So she, you know, she's kind of worried. She's asking around, you know, does anybody know, you know, what happened? We know he had these suicidal ideations and attempts, and, you know, nobody seemed to know anything. It was several weeks after that. He actually came back into the hospital, not to be admitted, but to thank her. And that is the power of a community health worker. And he had said to her, "I want to thank you for not only taking the time to talk to me, but for giving me the resource that I needed. And I am seeing a counselor now, and I'm not going to say everything's perfect because it's not, but I'm actually getting help that I need. And so if it wasn't for you, you know, I wouldn't be doing as well as I'm doing. So thank you." So that's just the amazingness of community health workers. You can go to the next slide. So how do they assist patients to address health disparities in medically underserved communities? Everything from educational awareness to help them, you know, attend appointments, to, you know, navigating those services. I always like to use the example of an individual suffering from diabetes. So from the provider's end of it, they may see that an individual's just not, you know, not compliant, right? They're not taking their medication, they're not showing up at appointments, or they're showing up late. And that's kind of, you know, what a provider sees. But when a community health worker steps in, they actually find out, well, it's not that they're necessarily not, you know, compliant. It's that they lost their job. They no longer have health insurance. Their car broke down as well, so they don't have transportation. And so their health and taking care of their diabetes is the last thing on their list. And so again, that community health worker works with that individual to, okay, let's go to, you know, CareerLink and see about getting you new employment. While we're waiting to kind of do that, let's see about applying for medical assistance, or what type of, you know, health insurance can we, you know, get you? What do we need to do as far as, you know, your medications? And so that individual steps in and connects individuals to all of the services, so that eventually what happens is they're taking their medication, they're, you know, they're employed, they're, you know, figured out some type of transportation. And so now the provider's saying, well, they're compliant and they're doing what they're supposed to be doing. Meanwhile, the community health worker knows that there were a lot of steps to get them to where they need to be, but they're breaking down those barriers and helping them so that they can actually become self-sufficient. You can go ahead. So we have trained over 550 CHWs since 2009, which kind of seems like yesterday to me, but I guess it's not. there have been amazing things that have happened in the world of community health workers since 2009 and the first program that I created for the AHEC system. And we've been really fortunate to be kind of a part of the whole field as it has developed, which has been, pretty neat. Certification of community health workers is actually still pretty new. It happened in early 2020, although we have been working on it in the state since, I want to say probably 2015. So it was a long time coming. And in 2021, what happened was, if you wanted to be a certified community health worker in the state of Pennsylvania, you had to go through an accredited training program. And so the AHEC program became accredited, which is really an honor to be a part of the state accreditation programs. You can go ahead.
Okay, so some key features of our training program. One is that it is offered statewide. All 7 of our regional centers offer the program. We really like the regionality of our training program because we specifically highlight and bring speakers in from local areas or the region to familiarize the trainees with resources. They have personal connection with those people and can very easily call them for assistance and to help patients with the issues that they're dealing with. We also can customize the training, and I'm going to let Liz talk a little bit more about the actual training program, the modules and things like that. So Liz, if you want to pipe in here again.
Sure. So there are actually 16 modules. It is 75 hours is the core of our training, and that is actually, those core modules are tied to the 8 domains put out by the Pennsylvania Certification Board. And so those modules are everything from, we have an intro and history of community health workers, but then we do boundaries, we do personal safety, motivational interviewing, cultural competency. We have a tobacco module, we have an opioid module, and many, many others. In addition to the core 75, we can offer 25, sometimes it actually ends up being a little more, optional hours. And those are in a little more specific training, such as mental health first aid. We're able to offer both youth and adult mental health first aid, crisis prevention, intervention. We do a verbal de-escalation program. In some communities, and actually, to be honest, with COVID, a lot of our trainings did not do this piece of it, but CPR, first aid, and so instead we substituted and did some other things, but human trafficking, oral health, mandated reporter. Really, we're able to work with each of your organizations to kind of design that 25 hours to work with, whatever you would like. So if there's a specialized area that you want more training in, we can certainly, include that. Trauma-informed care is another area that we've done as well. So it's really, we can tailor that piece of the training to anything that you would like. And you can kind of, pick and choose. We've had programs that do the core 75 because you need that for accreditation. And then just, say, hey, we want just mental health first aid or something like that. So that's where we really can work with you to make the program work for you and your region.
Fabulous. Thank you, Liz. And so we also, there are some regional learning collaboratives, particularly in southwestern PA, where community health workers get together on like an every other week basis and have some, presentations on various topics and have a chance to do some, group problem solving with issues that they're dealing with in their jobs. We also offer continuing education statewide. through Pennsylvania AHEC. And that's important because when community health workers get certification in the state, they have a continuing education requirement that goes along with that. Liz already mentioned that we talk about trauma-informed care, take that approach. We offer our training in person. We can offer it virtually. We can offer it hybrid. We can offer it on site if you have a group of individuals that you want to have trained. If you have just one or two, we probably prefer that you join a larger class so that there's more interaction and people have more opportunity to learn from one another. But if you have a small group of 5 or or more, something like that, we'll happily come to your site and do training. And the price is $1,500 per person. So we can move on. Oh, I don't know what's happening there. So here's a map of Pennsylvania. These are our 7 regions. So you can see there northwest is the pink, north central is the light yellow, northeast, the brown, then across the bottom, green is southwest, south central is in the middle. The darker yellow is, I'll call it our east central office. That's where Liz works. And then the reddish in the far lower right corner is our southeast. So we go by directions. That's how we name ourselves. And so next slide. And so we also have a website specific to, oops, not that far. There we go. A website specific to our community health worker training program. It's at pachw.org. And the key thing here to show you is that in the middle here, where it says PA-AHEC, is a drop down where you can connect to the AHEC center in your region to talk to them specifically about getting your community health workers trained and how we go about doing that in the way that works the best for you. Okay, next slide. So Liz is going to talk a little bit about the certification.
So there are 3 requirements needed for Pennsylvania certification. 1, an individual must attend an accredited training program, such as our AHEC program, and those programs have to have at least 75 hours. And then once they complete that training program, they kind of check that box, they have the educational requirement done, and then there are 2 other requirements they need. One is they need to work either a year full-time as a community health worker or something that matches that job description, because the Pennsylvania Certification Board understands that there are well over 167 titles for community health workers. So really they're looking at the job description piece of it, and they actually will be required to hand in a job description when they apply for certification. And so it can either be 1 year of full-time or the equivalent, about 2,000 hours part-time, can be paid or volunteer. And individuals are allowed to kind of combine that. So if somebody has worked 6 months as a volunteer, they can kind of take those hours and pair that with other hours that they've worked, whether that be paid or unpaid. If they have a couple of different jobs that they've done that they've been paid for that add up to that year. So the certification board is really great in helping individuals kind of look through that and help them figure out kind of what works for that employment piece of it. The employment has to be within the last 5 years. And in addition to that, that last requirement is they have to have 60 hours of supervision within the 8 domain areas, which are in the application. But those are areas like health concepts, advocacy, care coordination, health literacy, and so on. And they only need 60 hours in those areas. And when they say supervision, it can be anything from professional development to meetings to discuss a particular patient, to general trainings. It's kind of loosely based. So there are a number of options for them to make up those 60 hours. The certification's for 2 years. And then after that point, they have to recertify. And the cost for the initial application is $50. It's $75 to recertify. But within those 2 years, they either need, they can break it down however they like, but either 15 hours of continuing education each year or a total of 30 hours. And this can be from a number of different activities that they do, whether that be, free continuing ed type activities they do or paid for ones. If they go to classes, that counts as well. And it's open to be kind of any type of health topic that's needed for their particular position. They do a lottery system. So we always tell community health workers to keep all of your training certificates or transcripts, because when they put in for that recertification, what will happen is if they are selected, they then need to turn in all of those certificates or transcripts for the trainings that they did attend that add up to those 30 hours. And there are a number of different opportunities for them to certainly make those hours up for sure. And we work really hard with our community health workers to make sure that when their applications go in, they're perfect applications. The PCB actually loves us because they don't have to send the applications back. There are little questions, and we purposely do that. So in every training class, we take some time to make sure to go over that application, so individuals know exactly what they need to do and what they need to ask their supervisors in order for that application to be completed without any issue.
Okay, so wrapping up here, the continuing education that we offer is through Project Echo, which is out of the Penn State College of Medicine. We have had 7 sessions so far of the ones that have been scheduled. 5 more are yet to come. We offer recordings of these. Several months after each of these sessions, we're actually trying to encourage people to attend the session so that they can have the interaction and group learning as part of that. And so the link to the registration form is there. And so if you have community health workers right now that have not been participating in this, we highly encourage it. It's free, and it gives them continuing education credits that they need for recertification if they're certified now. And so we can get you these slides so that you can actually use these links. They're live links in the slides. So, and then the last slide is just, thank you, and my email address and Liz's email address, and please be in touch if you have any questions. Liz and I will try to answer questions here in the chat as well. So thank you very much.
Thank you so much, Pat and Liz. Thank you so much. So next we are going to have Lori from NEMA. Lori, I'm going to pull up your slide for you.
Great. Thank you, Jillian. And I'm glad that you got them because I know I just sent them right before we started. Can you hear me okay?
Yes, I can hear you. Can you hear us?
Okay, perfect. Yeah, I can hear you great. So thank you both to you and Jed for including me today. And I'm going to talk really, really quickly because I really do want to yield the floor to, I think Melissa wants to speak about their program as well, and then have any questions. So I think I've got 10 slides. I may only touch on 5 of them, and you guys will have them if you want to refer to them later. But I'm going to breeze through as quickly as I can. If you want to pull up, I think you're probably pulling up the slides, Jillian.
Yep. All righty.
Perfect. Thank you for helping me navigate. All right, we can just go to the next slide.
Okay.
Perfect. Yep. Okay, great. So basically, NEMA has 2 different programs out there. There's an 8-month training program for folks who are brand new to becoming an MA. Let me backtrack for just a moment and just tell you what NEMA stands for. We are the National Institute for Medical Assistant Advancement. It's a mouthful, so you'll see it abbreviated as NEMA throughout this. And I should introduce myself. So I'm Lori Nichols. I'm the Director of Partnership and Business Development for NEMA. So with that, so we've got 2 programs. We have our 8-month training program, and we have some upskill continuing education courses Most of what I will touch on will be the 8-month training program, but if you have any questions or interest in the upskilling as well, happy to take any of those questions offline. We can go to the next slide. Perfect. We have several partners already there in Pennsylvania. I've seen a few friendly, familiar faces on this call, so super happy to see folks who are already working with NEMA. They're listed here. I won't read them off. You may see your own organization listed and be like, oh, I didn't know we were already a partner with NEMA. But you also have this list in case you did want to reach out to another health center there in your state and just find out a little bit more about what their experience has been so far. How we define our partners are folks that are offering an externship to our students who are in the 8-month program. And it may be as few as 2 students, it may be 5 students, 6 students, and so forth. So we've got different size partners in the state, and some of these folks are brand new. Delaware Valley, for example, is a brand new partner of ours, which is about to kick off their first cohort in the fall, while we have others who have been partners with us for several cohorts now, Primary Health Network being one of those. We can go to the next slide. Perfect. Just a little bit about what makes us different and unique. Obviously, there's other MA training programs out there. NEMA was created in 2016 by 2 community health centers. So our focus very much is in primary care with a heavy, heavy emphasis on team-based care. A couple of things that make us different in terms of how we operate is our extensive in-clinic experience. So we have the externship that begins from day 1 of the program. So they are doing an externship their entire 8 months. What that looks like is 10 hours a week of externship while they're doing online. It's about 15 to 20 hours of didactics, and there are some synchronous components, which I'll show on another slide. So most of it is asynchronous and online, but there's a couple things that have to happen at a certain time, particularly with the externships, skills labs, and huddles and things like that. We do prepare the medical assistants to take a number of national credentialing exams. We do let the student choose which one they would like to take, but we include it in their fees and such. So while we can't require our students to take a credentialing exam, we very much treat it like, why would you not take an exam? It's going to help with hireability. It's going to help demonstrate your expertise. It's going to help prepare you for, being able to demonstrate exactly what they've learned and move up within an organization. So we kind of treat it like it's required. We can go to the next slide. Perfect. This is just a quick look at what a student's week might look like with NEMA. So you'll see the huge chunk, which is their online instruction, that 15 to 20 hours a week. The next biggest piece of the pie is their externship at 10 hours a week. The total requirement for the hours is 960 hours for the 8-month program, and 240 of those hours are the externship. What we don't want is a student to blaze through their externship hours, get through all of them in the first couple of terms and be like, okay, I'm done. I don't have to do my externship anymore. That actually doesn't serve the externship well, and it doesn't serve the students well, because then they can't be practicing what they're learning. So we ask that their externship remain pretty consistent at about 10 hours a week throughout the course. Then there's skills labs that happen every other week. They also have huddles with their instructors, and we do a synchronous seminar once a week where all the students from Pennsylvania, Hawaii, Connecticut, and so forth are all coming together to talk about some of the more complex concepts. We can go to the next slide. This slide is in here just to sort of reinforce our model, in that because you have students that are coming to you right from the beginning, they can be very green, very limited in skills. They quickly ramp up. Hopefully our partners who are on the line can attest to that, and hopefully this resonates with you. Hopefully becoming very effective, pretty much by term 2. There's a total of 4 terms, and very predicted graduation, so that if an externship chooses to hire a student upon graduation, there's really no retraining that has to be done. All the onboarding and such has really happened in their student capacity. Next slide. Great, and we can I'll touch on this really quick and then we'll go to the next one. We work with our externships in a number of different ways. There's no price or financial commitment to become an externship organization with NEMA, but there is a lift from a human resource perspective, right? There's somebody who needs to sort of be the program coordinator and be our point of contact. There's preceptors, there's having a leadership or executive sponsor. and then a site facilitator, which is our term for the person who is physically in the room during the skills lab. While they are not teaching the skills lab, they're just making sure that things are running smoothly. So we do understand that there is a lift from the externship side, hopefully well worth it when you have a cohort of folks at the end of the program who know your mission, love your organization, and are ready to be hired. Next slide. This is just a listing of some of our upskills. So yeah, great, you've got some NEMA graduates, then what? Then what happens? Or maybe you have medical assistants that didn't come out of the NEMA program. We do have continuing education courses that we offer under what we call Upskill NEMA. They're listed here. I'll mention the CHW course only because we just heard that great presentation from AHEC. This upskilling course is not meant to take the place of anything like an AHEC course. It's a 20-hour course, fantastic course for folks who are interested in learning more about the role of a CHW, particularly if they're an MA and they're working with CHWs, or they're thinking about maybe they want to become a CHW. That's a great overview course for them. And then several others listed here. On the next slide, we have a little bit of information, and we can go there on sort of the costs and all of that. So again, just trying to move quickly through these. Those upskilling courses are available at any time. So different from our 8-month program that has 2 academic starts per year, one in the spring and one in the fall. Upskilling can really be taken at any time by anyone. It's $20 per hour, and the courses range in their length. So that CHW one that I mentioned is a 20-hour course. Our Introduction to Health Coaching is only a 5-hour course. So you can, sort of do the math and figure out how that cost can differ depending on the courses. Really great for folks that either want to refresh their skills or, go to their supervisor when it's time for their performance review and say, hey, I've really taken initiative to learn more about my role and to step up my game by taking these continuing education courses. Flexible format, we do have they're all online and asynchronous as well. And we have an instructor that's sort of working in the background and facilitating the discussion forums. That may be my last slide. We can go to the next one and just make sure that that is the case. Yeah, there's my contact information. I know that was super fast. I could talk for hours and hours about each of these programs, but I'm happy to take any questions in the chat or take any questions offline. And with that, again, I'll just yield the floor to Melissa if we have time.
So
Good morning, everyone.
Okay, sorry. Go ahead, Melissa. Go right ahead. Go right ahead.
I'm sorry. Did you have someone has a question? I'm sorry.
No, that was me. I was going to introduce you, but go right ahead. Floor is yours.
Okay. So I am Melissa Burnett. I am the Workforce Development Manager here at Hamilton Health Center. Hamilton got involved in the medical assistant program during the summer of 2020. And this was during, of course, when COVID was new to everyone, and a lot of staff ended up leaving for one reason or another. And we needed to look into how we could essentially grow our own pipeline of medical assistants. So after several months of just looking into different programs, the NEMA program is the one that we decided to go with. And it took about 8 months from start to finish, from looking into it and just seeing what we needed to do as an organization to become a partner with NEMA. And we had our first cohort spring of 2021. The students in that cohort did complete the program. They both successfully passed the CCMA certification, and we actually offered them employment working as CCMAs, which was really awesome for them. And I'll just back up a little bit. One of the unique things that Hamilton also decided to do for the students is to offer them part-time employment working in the healthcare setting in a non-clinical role, excuse me, so that way they could earn an income while they were learning to become a medical assistant. This was huge, of course, for the students because, of course, they needed to have an income, and being able to get their foot in the door working in the healthcare setting just gave them an opportunity to see what they would be, working in once they did, in fact, complete their program. So once they were hired, we had already started the process with Labor and Industry to become an apprenticeship program. So in April of 2021, Hamilton Health Center became a apprenticeship program for medical assisting, which is awesome, just to give additional opportunities for the new medical assistants to gain proficiency in all their skills. They go through the program for 1 year. They rotate through our 3 clinical departments, which are our adult medicine, our pediatrics department, and our women's health services. So that way they will essentially be cross-trained and be able to fill the void if the need is there. If we're short-staffed, they can just jump in and rotate through the departments, again, which is what we needed for Hamilton to keep all of our departments fully staffed. We also, with that first cohort of students, offered them a incentive to reimburse them for the tuition that they paid for the NEMA program, since that was before we became an apprenticeship program. So that was just another tool in our box to, certainly encourage the medical assistants to stay with Hamilton Health Center, and doing that by reimbursing them the tuition that they did pay out. So we do also accept students or current CCMAs outside of Hamilton Health Center, meaning if there is someone who is currently a CCMA and they would like to go through our apprenticeship program, they are able to contact us and go through that process. If someone certainly wants to become a medical assistant, they are able to follow the process as far as contacting us and just walking them through enrollment with NEMA and giving them the opportunity also, if they would like part-time employment while they're going through the program. Also the opportunity to work in the apprenticeship program by gaining that the proficiency, because even though you have the credentials, most employers would like someone who has some sort of background and training in it. So that 1 year of apprenticeship really provides that for them, as well as the support working along for those who went through the program, their preceptors, and they're familiar with Hamilton Health Center. I am happy to announce that we are entering into our 3rd cohort with NEMA this fall, and the program continues to grow. I have multiple calls, emails, pretty much weekly, just interested candidates, different social service groups just reaching out for additional information for their clients. And I definitely look forward to continuing to work with NEMA. We also have another educational entity, which is Harrisburg University. We have a partnership with them in regards to the medical assistant program that they offer through HU. Once the candidates complete that program, they are able to come to the skills lab with me to practice hands-on for all of their skills. Since the HU program is completely synchronous, they don't ever go into a classroom. So we certainly felt that it was necessary for them to come in and actually do hands-on with venipuncture, vitals, EKGs, essentially everything that they would need to do working as a medical assistant, they will do in the skills lab with me, hands-on. And what that does for the HU students, it provides them an opportunity to be guaranteed a spot for their externship hours, which they complete at the end of their online portion of the program. So again, just having different options. I do know that the students absolutely love the NEMA program because it is a higher touch. They're able to access the NEMA instructors as well as me, and just have that extra guidance that they just seem to need to navigate them through their training. So it's been really great. So that's essentially the medical assistant programs that we offer here at Hamilton Health Center.
Right. Thank you so much, Melissa. Thank you.
Thank you.
So, Jed, were we able to answer all of the questions in the chat box? We're coming up on 12 o'clock here.
I guess some questions have been asked out there. Lori, you had one question from somebody from Monica Deal. I see Liz Schaefer weighed in with a answer to Shelley Duncan's question. So it looks like questions have been answered, but we can keep this going as long as people can stay on and answer questions. So Um, one question I would have for all three of the speakers is, if somebody wants to include you on their proposal that they have to submit to Jillian by August 5th, what's the next step as far as partnering with you? Should they give you a call? Should they set up a quick meeting, find out or can they just I'm assuming you'd want like a heads up that they're planning on putting you in their proposal.
Yeah, this is John Claywise with Career Step. That would be awesome. I'd love to talk over kind of the needs from a training perspective and provide some more detail on kind of how we partner and the agreements and all that kind of fun stuff. And so I would love to, if anybody has any questions or like to contact me directly, would love to set up some time to chat. So that, whatever works for everybody on this call, we definitely don't want to increase the workload or the effort needed to partner. So however works is fine with us. We're super flexible.
All right, sounds good. So thank you, everyone, and we will send out those slides. If anybody has any questions, please feel free to reach back out to me. And
I also just actual proposal.
You or
I'm sorry.
Sounds like
Might have some glitches. Not sure what happened.
people are. No, I think people are closing out, heading home, or heading to lunch.
Okay.
So
Thanks, everybody.